The aim of this video is to raise awareness of the importance of mouth care at the end of life. A dry, sore and painful mouth can lead to unnecessary distress for individuals and their families, and can impact on communication, eating and overall dignity. Oral problems that often develop at the end of life include a dry mouth, oral pain, fungal infection, mucositis, and dried oral secretions. Supporting people to maintain a clean and comfortable mouth is an essential part of personal care. Assessing the mouth at the end of life. Individuals should be asked daily if they have pain or discomfort from their mouth, and whether they need help with mouth care. Support can include bringing mouth care products with a bowl to a person who's in bed, or carrying out all mouth care during the later stages. It's important to assess the mouth daily with a light source. Start with the lips. Are they dry, cracked, or bleeding? Check the tongue, cheeks, and palate. Does the mouth look or feel dry or sticky? Can you see any food debris or dried secretions? Is there a creamy coating on the tongue or palate? Does any part of the mouth look red or swollen? Is there any bleeding in the mouth? Are there any broken or very loose teeth that are causing pain? If the person wears dentures, ask, are they comfortable? If they're very loose, could they be a choking risk? Does the mouth look healthy when the dentures are removed? Dentures are often very important to an individual, and they may want to continue wearing them for appearance and communication. Any concerns regarding the mouth should be reported to a senior member of the team. Assisting with mouth care. Mouth care should be carried out gently and not cause the person distress. It may need to be carried out more than twice a day. For example, hydrating the mouth can be done hourly. Families often want to be involved, and mouth care is something they can be shown to do. If it's possible, have the person sitting up to reduce the risk of aspiration. Start with lip care. Apply a lip balm or water-based gel to help keep the lips moist. Follow this with dry mouth care, as overall it'll make the mouth more comfortable. Dry mouth care can involve hydrating the mouth using a toothbrush dipped in water. It can also be comforting to use a favourite drink instead of water for taste and pleasure. A small amount of dry mouth gel can be regularly massaged into the mouth with a gloved finger, mouth ease or toothbrush. When toothbrushing, use a small-headed toothbrush, as mouth opening may be limited and uncomfortable. A brush with soft bristles or a baby toothbrush should be used for people with very sore mouths. Mild-flavoured non-foaming toothpastes are often better tolerated than a strong minty flavour. Oral ulceration develops in 1 in 5 people in the last 3 weeks of their lives. In people undergoing chemotherapy or radiotherapy, mucositis, widespread inflammation of the lining of the mouth, may develop. This can be extremely painful. The medical team can prescribe both topical or systemic pain relief for people with severe ulceration or mucositis. It's important to keep the mouth clean to reduce the risk of infections. Over a third of people have been found to have oral thrush in the last 3 weeks of life. This often appears as creamy patches that when wiped away look red underneath. Thrush also develops under dentures, especially when they're not cleaned or removed at night. Regular mouth care is very important, and the medical team may prescribe an antifungal medication. Topical antifungals can be applied to the tongue and palate using a toothbrush. As the swallow and cough reflexes become weaker, medication may be prescribed to dry out chest secretions. This can lead to a build-up of sticky oral secretions in the mouth, especially on the tongue and palate. Regular removal with a soft toothbrush or mouth ease and careful oral suctioning can help minimize the build-up of secretions. Mouth care is an important part of the end-of-life journey and should be carried out until the end. In the final stages, this may involve keeping the mouth hydrated. A clean and comfortable mouth at the end of life contributes to comfort and dignity.